In the past year, we have seen rates of depression, isolation, and loneliness skyrocket. And that's not good because the more lonely that we are, the more likely we are to suffer morbidity and the more likely that we are to die. On top of all of that, the treatments for depression are marginally effective at best, and many people experience no relief despite being on a trial after trial after trial of antidepressant medications. It's time for us to look at depression in a different way. In today's episode, we talk about the functional medicine approach to depression. We talk about the root cause of depression that can lead to other mental health disorders such as anxiety and dizziness and tiredness and insomnia, as well as physical disorders like nausea and weight gain. We look at the root causes of depression and how we can overcome them naturally. Let's get to the show. Welcome to the Lindsey Elmore Show, a podcast that helps you find fulfillment amidst chaos. On this show, I interview thought leaders, doctors, creatives, spiritual gurus, and game changers who inspire you to pursue your dreams, overcome obstacles, and leave your mark. Depression is a very common psychiatric disorder that particularly affects older adults and about 15 to 20% of the overall population. Despite so many people who are diagnosed with depression, only a small fraction of them actually start treatment. Only about 1/3 of people with depression start treatment. For people who do adhere to antidepressant therapies, treatment of major depressive disorder can lead to an increased number of adverse effects, especially in people over the age of 65. Antidepressants that are really commonly on the market are your selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, and then there are individual antidepressants of bupropion, mirtazapine, trazodone, vilazodone, and vortioxetine. So specifically, SSRIs and SNRIs lead to a greater number of study withdrawals due to adverse effects, and duloxetine specifically increases the risk of falls. This is extraordinarily important to take into account for an older patient because studies have shown that if an older patient falls and breaks a hip, more than 50% of the women that break their hips will be dead within the next 2 years. So preventing falls is very, very important. Non-adherence to antidepressants is really common. 68% of females do not appropriately take their antidepressant therapy. They may just forget to take the dose, or they may find that it just doesn't work, or that side effects are preventing them from being able to take their medications. This is important because oftentimes antidepressant medicines are not very effective at treating depression. And they're certainly ineffective if the patient is non-adherent to the therapy. So when you think about functional medicine and what is the functional medicine approach to depression, I mean, clearly we have variable reports on how effective antidepressants are, but we also know that we have a very high level of clinically important depression. So clinicians are like, I don't know what to do. And studies have shown that physicians are not very good at differentiating between what is just my patient's just unhappy versus true clinical depression. And clinicians vary dramatically about how they diagnose depression, with some people using the DSM, the diagnostic criterias, effectively and using those checklists. Other physicians just say like, oh, you seem like you've got depression. You seem like you've got this going on. Well, that's not great either. And additionally, most patients that go to see their doctor, they get about 10 minutes with that physician. So it may be a problem of lack of time. It may be an inherent difficulty of the diagnosis, but some clinicians don't ask much at all about depression and how we can best treat it. But here's the great news. There is a wealth of research on the topic of depression, and a huge swath of studies help to point out the effectiveness of non-pharmacological treatments for depression. We know that there is an association between diet and mental health. And we know from a study that long-term adherence to a healthy diet may help to offer protection against recurrent depressive symptoms. The study looked at a sample of almost 5,000 men and women, and their diet scores were calculated using data from food frequency questionnaires over the course of 11 years. Higher scores on the Alternative Healthy Eating Index, the DASH diet, the dietary approaches to stop hypertension, and the Transform Mediterranean diet were all associated with a lower risk of depression. In addition, we know that we have supplements that can help as well. Some supplements that may help to elevate the mood include St. John's wort. St. John's wort has been used for centuries to treat everything from sleep disorders to mild depression. And it is easy to take, easy to boost mood naturally. However, it is important to recognize the way that St. John's wort works is that it increases serotonin. And so when you increase serotonin, if you're on a SSRI or an SNRI, you can lead to something called serotonin syndrome, which can be life-threatening, which is not where you want to be. Additionally, St. John's wort has a ton of drug interactions, including rendering birth control basically ineffective. Oral contraception, I should say. Oral contraception, it just chews through it. So St. John's wort, not the best idea if you are on an antidepressant or if you're using a medication to prevent pregnancy.